Do you like Catherine?
She will go back.
Oh, I thought, well, have you seen it? You know, when she said I was gonna just put down her application, I didn't know which one it was.
So I had the surgery yesterday, and this is it. Nice and swollen. Yes, it does hurt. And the procedure time, I really couldn't tell you, because once they gave me the anesthesia, like the minute they gave it to me, I was out. I don't recall being wheeled into the operating room. Like 1 minute I was laying in the bed, and then the next minute I was in recovery. So I have no recollection of anything that happened during the surgery. So what my surgeon did was she went in and she removed the old graft and she replaced it with a new one. But this time, she made a little bit of a revision this time. So instead of just replacing it with another like artificial like tube, I'm not sure what the material is made of, maybe silicone. But don't quote me on that. What she did was she replaced it with a bovine valve. So a valve from a cow. And then they put it in, and it's supposed to be better than an artificial one as far as longevity and less risk of a bolus forming. So as a result of this, it's going to take about 4 weeks. So it's going to take 2 weeks to heal, 2 weeks to use it, and then the catheter that I still have here is going to be removed. Dialysis has not been a fun experience for me, right? Like, I can't speak for other patients, but I'm sure they'll probably give you the beautiful lie that most dialysis patients give to people who ask them about how they feel about this. But for me, like, this has not been, like, it hasn't been great. So before the surgery, I wasn't thinking so much about the surgery. I was thinking more so about the recovery time. Because the recovery time is like the worst part of it. My arm is swollen to twice the size it normally would be. Like, I'm hurting. I'm taking Tylenol left and right to deal with the pain. And the worst part is that I still have to come do dialysis on top of all of this, right? Like, there's no downtime, there's no vacation time, there's no sick leave, there's no none of that. Dialysis and kidney disease is just this relentless, bottomless pit of a monster that just never gets full. And when I explain it to people, like, they can't understand why I don't think dialysis is the greatest thing that ever happened to me in the history of my life. Like, right now, at the time of this recording, like, I don't feel that great. Like, I don't feel good at all. And this is just one surgery amongst, like, I don't know, a bunch of surgeries that I've had on the same arm for the same reason, and that was the graft stopped working. As somebody who, prided himself on his freedom, like, dialysis very much feels like a prison sentence to me, right? Like, you get a lot of people try to convince you that dialysis doesn't change anything in your life, right? Like, it's just, you can still do all the same stuff you could do exactly the way you did it. And that's not true. You spend a lot of time doing dialysis. If you're doing dialysis correctly, you spend a lot of time doing dialysis. You put in a lot of hours, you put in a lot of time. You feel the effects of dialysis constantly, right? Like, it's not like a thing where they just put me on for 10 or 15 minutes and then they take me off and then I just feel great and I'm just bursting with energy. It's not like that. the reality is that I am not the same person I was before all of this stuff happened. And there's no positive thinking. There's not enough positive thinking in the world that's going to change how this has like affected me physically. And this procedure that I went to yesterday to a vascular access replacement is what it was. And it's very common. You know, if you're a dialysis patient, you're probably going to experience that too. You know, have it be a graft or a fistula, you know, sometimes things go wrong with these accesses, and they need to be fixed. And these are life-changing events. You know, it's a life-changing decision to decide to do this. You know, and people say that I'm ungrateful and I'm unappreciative, or you're not appreciative of life, and you're ungrateful. And it's just like, I'm doing this because I love living. Right? I'm doing this so that way I can get an opportunity to live again. I'm doing all of this so that way I can get a transplant, so that way I can have better energy levels, so that way I can live life to its fullest, so that way I can not have so many restrictions, you know, on my life. I love living, but I don't love dialysis.